Hello everyone, the article that I chose is entitled Strategies for Changing Your Organization's Culture. The article does not have a specific other mentioned. It was published in 2011 in the Bridgespan Group Review. The article discusses how leaders are able to make effective cultural changes within the organization. The article is presented from the perspective of a non-profit leader who needed to change his organization fundamentally in order to make it more effective. The article discusses how he was able to do so through addressing key levers for culture change. Culture is in essence an organization's operating environment, the implicit pattern of behavior, activities, and attitude, shaped by a shared set of values and beliefs that characterize the way people work together. In order for any strategic change to be implemented successfully, the organization culture needs to be aligned. We need to understand culture because it helps explain many of our puzzling, frustrating experiences in social and organizational life. This is usually determined by the individuals who have been in the organization before us, which is culture. They determine the way things are done, people should behave, and different operational processes. For example, think back to when you started your job or any shift in careers that you have had. You've had processes that are consistent and processes that can be changed. People do things a certain way because they've always been done that way. That becomes culture because that becomes norm for those people. However, in order for that behavior to be changed, role models need to implement that change. When people see the executive leaders implement the change, then they are more persuaded to adapt the change as compared to being asked to change, but yet the leadership is not adapting to that change or is not showing support for that particular change. Previous slides have introduced culture and provided a brief explanation why an organization's culture can be challenging for leaders to change. Now let us dive into the article. Liberty Resources Incorporated, founded in 1979 and headquartered in New York, is one of Central New York's most diversified human service agencies, helping children and families, as well as people with developmental disabilities and mental health needs. The founder, Coyle, realized there was a significant waiting list for mental health services, particularly for children. Only two other private clinics existed in the country, so he envisioned acquiring clinics which would allow Liberty Resources to provide the population it served with a much-needed service that would otherwise be lost to the community. For Coyle, acquiring clinics meant adapting to the new clinic's culture or changing the culture of the new clinics. The acquired clinics had a different culture, which included a lack of accountability, inaccurate accounting, finance, or data reporting systems. Liberty Resources organization was thriving in an accountability culture, where strong reporting systems and a focus on measurable clinical outcomes enabled the organization to thrive. One of the challenges that Coyle discusses is how the acquired clinics could not tell if they made any difference using the data they were computing. For example, the clinic's patient census listed 1252 patients, many of whom had been getting the same service for over 20 years. The data alone told Coyle that the clinic was not operating effectively as it could. That is far too long a time for the approach they were using, Coyle said. Many of these patients needed a different service than they were receiving. Because an organization's culture is a learned behavior, which enables processes to be completed, Coyle relied on the unrelenting pursuit of excellence. This meant pushing people to change their way of thinking and their behaviors. With the change came a high turnover rate within the acquired clinics from executive leaders to employees. Some employees could adapt while others could not. Nearly half the staff of the acquired clinic left, most by their own choice. When Coyle was asked how he managed to change the culture of the acquired clinics, he said he provided the employees who stayed with the organization incentives to match Liberty Resources higher pay standards. The new acquired clinic employees had not had a raise in 3 years. Clear expectations were set. There was the provision of functional technology that allowed employees to see where they were meeting new performance expectations, and the provision of basic necessities. We can all relate to provision of incentives at work and provision of resources to do our job as a great way to boost employee morale. However, I found it interesting that COIL used this as a tool to encourage a change in culture, relocating clinicians into a building that could support their work. In short, culture is only an abstract when we become short-sighted. As quoted in chapter 10, page 158, in the book written by Edgar Schein, as we develop culture abstractions, it becomes possible for us to develop models, typologies, and theories of how things work. The changes COIL implemented over time affected both the clients and the staff members. When clients were asked how they felt about the new changes, one said he felt safe in the new environment and he had made substantial progress for the first time. This in turn led to increased trust between the patient-staff relationship. On the other hand, the staff members' perspective on operational processes changed. Instead of completing tasks the way they have always been done in the past, the staff embraced a data-driven decision-making and information-sharing system. The staff began to learn to stop and think before taking action and seek solutions validated by the data provided by the new systems. Leaders who are new to a company and are planning to change certain behaviors within the organization all face the challenge of gaining the trust of employees. When leaders at the top level leave the organization during the change, the signal sent to the lower level employees is that the new CEO or top level leader is wrecking the company. The trickle down effect becomes that more people leave the organization during the implementation of the new changes. The few who stay, some optimistic, reap the benefits of the implemented organization changes. A culture of change within organizations ensures that they remain relevant for the community and the people they serve. Healthcare organizations are constantly changing the way they deliver healthcare services in order to improve the well-being of communities and the people they serve. For example, in the past, when Cox Health in Springfield acquired Skaggs Branson, the CEO ensured that the new organization changed to match the culture of Cox Health. After reading this journal, I am reminded of the two key dimensions of culture by Goffey and Jones: sociability and solidarity. Coyle had already built these things at his company, Liberty Resources. His challenge was how to impose the two dimensions successfully in the clinics which would merge with the main company. Sociability is seen when executive team members build trust with employees over time by communicating frequently, being visible, and following through on promises. While on the other hand, solidarity is seen when COIL moved slowly and carefully to introduce new disciplines to its mental health services, including contracting with a graduate medical school program to have nurse practitioners work in the clinic to help them meet program experimental requirements. He also partnered with a university undergraduate program for marriage and family counseling. The entire faculty and student population moved off the university campus and are now housed in the same new building where the clinic resides. This proximity has encouraged opportunities to share knowledge and has introduced a culture of learning to the clinic staff.
If you go to file again, compressed media, you'll want to go to internet quality. So it's just making it so it's